Hello, this is Philipp Bagus. I'm professor of economics at Universidad Rey Juan in Madrid. I will present a paper called COVID-19 and the Political Economy of Mass Hysteria. It's co-written with Antonio Sanchez Bayon and José Antonio Peña Ramos. And in the paper, what we do is to develop a political economy of mass hysteria. That is, we compare how mass hysteria develops, grows, and shrinks in an idealized, minimal state of free society, and compare this with the institutional factors that influence the growth of mass hysteria in a modern welfare state, a centralized big state. So first of all, let's define what mass hysteria is. Mass hysteria is a well-studied subject in psychology. There are many studies on mass hysteria. Mass hysteria is, now the definition is when a group of people gets collectively upset on a threat, being it an existing or non-existing threat. Yeah, and as a consequence of the mass hysteria, the members of the group may actually develop symptoms, or the symptoms become more severe. So in an epidemic, there can be a mass hysteria. And there are many mass hysterias studied. Normally they are studied in localized settings, for example, mass hysteria in a factory. A worker in the factory sees a bug or believes to see a bug, so there's a threat, and then he starts scratching his skin. Others observe this, other workers, and they also start scratching their skin, and so on. At the end, the whole factory has the symptoms, all workers have the symptoms, and at the end it's found out that there has been a bug. Yeah, so it's merely psychological. Yeah, this fear, these reactions is contagious. Yeah, we have to keep into account that feelings are contagious, and stress and anxiety are also contagious. There's also a telling example of a Portuguese TV show, a very popular TV show, and seen which was seen by the younger population. And in the TV show, one of the main characters gets a very contagious virus, or some of the main characters get the virus, and after the TV show ends, then next day, people in real life, the people who watched the TV show, also get the symptoms. Yeah, and at the end, 3 schools have to be closed in Portugal due to this mass hysteria. And then an investigation is launched, which finds out there was no virus. It was just a psychological reaction. Yeah, this is a typical case of mass hysteria, and there are many cases. And so mass hysteria can exaggerate or enlarge the reactions that a normal epidemic would have. So the symptoms become more severe, and there are additional symptoms to it. So mass hysteria may be a contributing factor in epidemics. So there may be a non-existing threat, but there may be also an existing threat which is highly exaggerated, leading to a mass hysteria. In this regard, it is very important to point out the notion of nocebo effects. Yeah, a nocebo effect is the opposite of a placebo effect. Placebo effect is we think that we are going to become better or to get better, and then we get better because we think so. It's psychological. And a nocebo effect is the opposite. We think we will get bad or worse, and we get worse because we think so. Yeah, and there's a one telling case that we also mention in the paper, which is a guy who is actually member of a trial, a clinical trial, trying a new drug. And he wants to commit suicide. So he just takes in and swallows 28 pills of this drug. And then he gets symptoms, he gets breathing problems, your heart starts to move very hard, very, very fast, gets to the hospital, and they manage to stabilize him after some work. And then the doctor who controls the medical trial arrives and tells the guy that he was a member of the control group. So he was not actually getting the real drug, but he was just taking placebos. So he was trying to commit suicide with 28 placebos. And he almost died. He got very strong symptoms. And when he's told by the doctor that he was just taking placebos to commit suicide, well, he gets better immediately. So we see that this is psychological. Yeah, psychology has a very strong effect on our health, and so this is a reason for mass hysteria and why it can have real symptoms. And the mass hysteria can also break out in a small state, in a minimal state, or in a free society. Why? Because there's a negativity bias in the human brain. We focus on negative news, on threats. Yeah, when there's a negative news, it could be a threat, so we focus on it. And if we get all day long negative news, we can get into a state of stress and anxiety that we develop hysteria, and then through contagion, it may become a mass hysteria. So this may also happen in a free society where there's no state. However, there are several self-corrective mechanisms that can reduces the size and the growth, slow down the growth of a mass hysteria in a free society. And these are basically strategies that reduce stress, because stress and anxiety are the perfect ground for a mass hysteria to develop. And what are these strategies? Well, doing physical exercise, socializing with other people, diversion, distraction of the negative news, of the threat, to think of other things, so social interaction and so on. This drives down the stress and therefore the possibility of a mass hysteria to develop and grow. And as you may have noticed, these are exactly the strategies that have been prohibited in lockdowns. In the COVID-19 crisis, there was social distancing imposed, so no diversion, no distraction. It was even in some countries prohibited to do sports outside. Some kinds of sports were totally prohibited. All things that get you distraction and are fun were prohibited. So this is a perfect environment for mass hysteria to develop. And also there's masks. If you if you see people with masks, so you cannot see their facial expressions very well. So this also produces stress because you cannot see if they are smiling or not. Yeah. And even if a mass hysteria would develop in a minimal state, there are still limits for the harm that can be done. Because even though people, when they are in a mass hysteria, they do irrational acts, they act irrationally, so they can produce much harm on themselves and others. However, there are limits to this harm in a minimal state or in a free society because property rights are protected there. So the destruction that can be done by those who succumb to the mass hysteria is limited by the property rights that protect the life and property of others. While this is not the case in the modern centralized state, where private property rights are not protected. And we have seen this during the COVID-19 crisis, that private property rights were not protected. There have been shutdowns of private businesses. People were forced to stay within their houses, even though they were they were not ill. And all kinds of private businesses were closed. Private property was seized. The use of private property was prohibited. So once you have a mass hysteria in a modern state, or imagine that a government succumbs to mass hysteria and acts irrationally. Yeah, a group of people who gets infected by mass hysteria gets control of the state. If there's no property rights that can limit the harm they can done, where the destruction may be biblical. Yeah. So this is another difference, yeah, between mass hysteria within a free society and a mass hysteria in a modern centralized state. And the next difference that we discuss in our paper is the possibility of experimentation with alternative solutions. So in a free society, everyone can experiment, try different ways to address the threat. So a businessman may say, well, I close my business for some days, for some time. Another businessman may say, well, I keep it open, but I will make controls of temperature of customers, or I limit the numbers of customers that can get in. Others may say, well, you can only enter my business, my shop with a mask. And others may say, well, business as usual, you can come in as usual. So due to this experimentation, there will be results, and these results can be compared. And through this comparison, the real threat can be easier be discovered. It's the idea of the Hayekian discovery of knowledge. Yeah, only through experimentation, through creativity, we can actually find out the real threat. Yeah. And if we would have a world government and there would have been a world lockdown with everything one size fits all, then we could not even have seen the difference that we see now between different countries, like Sweden and so on, that they do different things. Yeah. But the more decentralized a system is, the better the information can be created and difference can be seen. In the modern welfare state, there's a one size fits all. Yeah, and then there's groupthink, because we don't see differences. Every business is closed down, so everyone does the same. Groupthink develops. Everyone does the same, and groupthink is a perfect ground for mass hysteria. Yeah? While when we have different options, different alternatives, some people just behave normally, like before. And then we can observe what happens to these people. Do they actually die like flies, or do they do they not? And if they do not die like flies, then some people may say, hey, these people, they don't act like there would be a terrible threat, so maybe it is not. Especially for the borderline cases that have not succumbed yet to mass hysteria, if they can observe that other people behave freely and more or less normally, then they can resist to the mass hysteria, and this stops the growth of the mass hysteria, and the mass hysteria eventually shrinks. The next point is what is contributing today to the possibility of a mass hysteria to develop is a politicized mass media. If we get negative news 24 hours, 7 days a week, and especially with today's social media, when we are connected many hours a day with social media, we get always the negative news, then it's the possibility of a mass hysteria to develop increases. And today's media is politicized due to several reasons. One is that we have public TV channels, we have public radio channels, we have licenses for TV and radio. We have government participations, indirect and direct, in media, and we have, of course, journalists themselves tend to be statist because they went through statist education, universities and schools, so they went to state schools, so they tend to be statists. And they then tend to support the government in such mass hysteria, and they are also sensationalists because sensationalist news sells, so they exaggerate the threat also, and they buy the government news and they get a close connection to the government just because the news come from the government, or the important political news come from the government. So if we get the government news of in a privileged position, we need a strong, tight relationship with the government. So when we have here the collaboration between the government and the politicized mass media, then the possibility of a mass hysteria increases even more. And when it has been also seen in studies that when the negative information comes from an authoritative source, it has an even stronger impact on our stress and anxiety level. So in a free society, there's no one who has a high authority over everyone else. But today the state has almost a sacred authority. And then if someone like Anthony Fauci comes and says, well, and in the sacred halls of Congress, which it's sacred, no one else can actually touch it. So that he comes out of the sacred halls of Congress and tells us that there's a virus that is 10 times more deadly than the common flu. Then this, and as people regard the state as to be responsible for public health, then people, of course, think this must be a terrible threat, and there may be a mass hysteria much more easily because of the high authority of the state and the negative information that it spreads. And another factor that today contributes to mass hysteria is that fear is used as a political factor. Fear, in fact, is the foundation of government, because government builds on the narrative that it says, we are here to protect you from a threat. So give us power over you so we can protect you from a threat. Yeah, it can be foreign threat. It can be foreigners that may invade us. Maybe the weapons of mass destruction of Saddam Hussein. So we have to invade Iraq because it's a threat to us, and we have to increase government power to protect you. Terrorism is another threat that has been used again and again to increase government's power. So it's in the interest of the government to emphasize and exaggerate threats. Yeah, because this gives government the possibility to increase its power. Government officials get more power, and we have seen this also in the corona crisis. Yeah, that governments actively instilled fear in the population. Last April, there was a paper leaked from the German Ministry of the Interior, which actually recommended the government to instill fear in the population through several devices, several ways. One was to emphasize the death of suffocating due to the virus, and the authors emphasized that there's a primordial fear to die of suffocating. So if this fear can be activated, much easier to control the population. And the other way was to instill like guilt in children, saying, well, children themselves don't have a possibility of die, but if they play with other children, then at home they infect their parents and grandparents. These die a terrible death at home, and it's the most terrible thing for children to think that they are responsible for the cruel death of their parents and grandparents. So this was also a way to instill fear. And the last way was to emphasize long-term negative long-term consequences of corona, that even years sometime afterwards you might die a horrible death or sudden death due to corona. So we have this actual evidence that governments looked for strategies to instill fear in the populations in the corona crisis. So, and this is of course is a perfect ground for a mass hysteria to develop. Yeah, it's actually outside the scope of the paper if there was actually mass hysteria in the corona crisis. I mean, there's some anecdotal evidence, people driving alone in cars with masks, or people hoarding toilet paper, or people people not leaving their homes for months, even though they have a terrible high survival rate for coronavirus. But anyway, these are just evidences. In our paper, we more focus on comparing the differences in the possibility for mass hysteria to develop in a state, or how the state promotes or increases the possibility of a mass hysteria to develop. And yeah, the last factor is that I want to mention is the asymmetric payoff that politicians face. Because if they underestimate a threat, if politicians underestimate a threat, they may be punished directly by voters. Like if there's a threat they underestimate and then there are deaths, then these deaths will be directly attributed to them, which is very bad publicity. If they overestimate a threat, like in the corona crisis, and there's a lockdown, then they can always say, we prevented deaths, and the deaths that may be created through the lockdowns, because there will be more suicides, psychological problems, alcoholism, because cancers and other illnesses will be detected later, treatments will not be taken. So these deaths are not so cannot so directly contributed to politicians, and some of them will only occur years later when they are out of office. So it's more long-term negative consequences. Also, the negative consequences of the economic crisis, which reduces wealth and thereby reduces life expectancy relatively to the life expectancy that would have occurred with higher wealth levels. So this cannot be as directly contributed to politicians. So they have an incentive to overreact to a threat and over-exaggerate this threat. And also the costs of the overreaction, politicians can largely impose on third parties, on others. If they impose, for example, a lockdown, the costs are mostly borne by others. The politicians still get their salaries, but the cost of the people who lose their jobs, these are not the politicians' ones, or of the businesses. Business people who build up their businesses, saved and worked for years to build up their business, and they lose their business due to the lockdowns. These costs are borne by others, or the psychological costs, or the depressions and alcoholism and so on. So these costs are borne by others. And in any case, if at the end there are some negative costs, politicians can always say, well, if we would not have acted, then millions would have died. And they can use the media, or the media can support them. The politicized media can support them in this narrative that without the lockdowns, millions would have died. So it's a clearly the incentive for politicians is to over-exaggerate, or to exaggerate the threat and to overreact to it. And this has, of course, very negative consequences for society, this overreaction to the threat. Okay, so our general conclusion in the paper is that the existence of a big state, big modern welfare state, makes the possibility of a mass hysteria to develop and grow, increases this possibility. And the harm that can be done through a mass hysteria is much greater when there exists a state, a big state, than if there exists a small state or no state. And actually, one conclusion is that if such things as mass hysteria do exist, and the psychological research shows that many cases exist and has developed all characteristics of such mass hysteria. So if mass hysteria exists, then it's a very dangerous. The state is a very dangerous institution to have. So it's very risky to have such an institution, because if a mass hysteria develops, then the destruction that can be done to society in terms of economic, psychological, and health consequences is tremendous. It's a biblical destruction that can occur. So mass hysteria actually gives us, therefore, a strong argument against building a big state or having a state at all. Okay. So this is basically our paper. I thank you for your attention. Have a good day.